12-year-old Son Pham arrives at Children's Hospital Boston for an injection treatment to shrink some of the giant veins on his face. In a week, Dr. John Mulliken will surgically remove the shrunken veins.
Son? There he is. Hi, Guy.
Hi, Doctor.
Hi, Alan. Good to see you again.
Yeah.
How you doing? You won any golf tournaments lately?
He's getting close.
Why don't you lie down for me, son? I just want to put your head down and see if it swells up.
Yeah.
A little bit, huh? You notice that?
Yeah.
That's good.
Mm-hmm.
And this part of the cheek still gets in the way when you bite down?
No.
Okay, well, sit up here for me, son.
Son has just a few more injection treatments and surgeries before returning to Vietnam. They should significantly reduce his malformation.
The real problem is the lip. It's been distorted and expanded by the venous malformation so that he now has a larger lip and a larger oral opening. And the question is, can I shrink it down by taking tissue from the inside, and hopefully that will narrow itself down.
Yes.
I notice he has a little movement here when he tries to smile. Show me a smile, son.
Yes, there is.
A little.
Yeah.
Now, relax.
The human face can make a remarkable range of facial expressions. They're produced by over 30 muscles that pull small areas of skin when they contract.
Close your mouth, pucker like this.
But on the left side of Son's face, most of the muscles are actually replaced by his swollen veins. The tissue between them is mostly a spongy mass.
You close your eye fine, don't you? Close real tight. Yeah, that's good.
With almost no muscle in his left cheek, Son can barely move that side of his face. And he will never be able to muster much of a smile. But Dr. Mulliken hopes to eventually re-engineer Son's lip.
If we get this contour a little smaller, I'm going to suspend the corner of his mouth with some tissue from his leg to the bone underneath, so it's held up. But I'm not sure I'm quite ready to do that.
No.
I'm going to keep on going to try to get this to shrink down, the corner to shrink down. Are you all set for tomorrow? Okay, son, I'll see you tomorrow sometime.
Okay.
The next morning, Son is back for another round of injections.
Yeah, I know. They're not exactly the height of fashion, are they?
Good morning.
Good morning.
How are
Good to
you?
see you again. Yeah.
Good to see you. How's everything? Good.
The injection procedure is called sclerotherapy, and it will be performed by Dr. Ahmad Alamari.
Great. Sclerotherapy is basically injecting the abnormal blood vessels with an agent or a sclerosing agent that will destroy these vessels from inside.
Son's malformed veins are so huge they would bleed profusely if they were just surgically cut out. But the sclerotherapy injections will drain the targeted veins of blood and turn them into scar tissue. They can then be taken out later with minimal bleeding.
As we discussed, the parts that we're going to address today will be these soft parts over here. Very good. And another one over there. And a couple of those around the eye and in the scalp over here.
Very good.
The medications we use are quite toxic, and we'll try to avoid the adjacent tissue as we're injecting toxic materials. 1, 2, 3. What about a little smile?
Today's treatment will be more physically traumatic than usual. For the first time, Dr. Alamari will inject the toxic agent into sensitive tissues inside Son's mouth.
Perfect. I will leave my initials in your face as I do all the time.
Son's bloated veins have been slowly closing up his throat, so the doctor will target an area near Son's tonsils to shrink the intruding blood vessels. In the short run, the toxin will trigger major swelling, which will invade his throat even more. There are also far bigger risks.
One has to be careful not to inject the medicine inadvertently into a normal nerve, because that will destroy these nerves.
If too much toxin is injected into Son's body, he could go into cardiac arrest and die.
Then we'll see you after the procedure.
As Son is wheeled into the OR, he's scared, but stoic as always.
He's a very brave child, very cooperative, and I've never seen him actually complaining.
You're doing great, son. Keep on breathing.
I go into the operating room with him, and I stay with him while they administer the anesthetic. And hold his hand, and when he's asleep, give him a kiss and leave the room.
There we go. Good boy.
See you later.
Dr. Alamari is about to inject a toxic chemical into Son Pham to shut down part of his vascular system. It will collapse some of his massive and unruly veins, allowing his facial structure to be re-sculpted, if everything goes to plan.